After an injury and as we age, our greatest hope is that we're healthy enough to get back to what we love. But sometimes pain doesn't always easily fade. Lasting months or years, chronic pain isn't always visible, but it has a distinct impact on 30% of our population. Think about that. That's more than 45 million Americans living with a condition that makes everyday activities like getting out of bed, going to work, seeing their friends, feel like they're fighting just to stay afloat. Studies also show that those living with these conditions like arthritis, IBS, fibromyalgia, they're twice as likely to contemplate ending their own life. It's a vicious cycle of pain, immobility, hopelessness, and depression. So how do we help those individuals against this rising tide of ongoing pain? Many in these situations forego management and treatment because what's the point? They're constantly being told about their snowballing deficits, that they're limited, that they're broken. These thoughts are festering in the back of their mind, leading to those feelings of anxiety and depression. Now, current literature shows there is a strong correlation between patient perspective and their outcomes, so that having a negative clinical experience can deter people from getting that care they need for pain management and setting functional goals. What if we're able to rewire the brain to help patients view their pain in a new light? I want to talk about talking about pain. My study takes away words such as, there is no cure, this is abnormal, it is problematic, and you are limited. Instead, replacing it with verbiage such as, this is manageable, you are stable, it is unresponsive, we can adapt. We've already seen significant improvements in overall patient outcome and outlook, and it seems like a simple enough solution. So imagine my shock to find many healthcare programs do not offer curriculum on communication strategies. We know that words matter in our everyday life. So why aren't we putting a greater emphasis on it in healthcare, where burnout and fatigue can more easily lead to empathy erosion? My study is meant to help encourage healthcare programs to get curriculum in early about the importance of effective communication, specifically kind communication. Because if, as providers, we can recognize that relationship actively between patient perspective and their outcomes, my hope is that one day we can sever that connection between chronic pain and depression. Thank you.